Conversation with nurse at hospital.
Good morning, nurse.
Good morning, miss. What can I help?
I just wanted to ask some questions about the cost in this hospital.
Of course. May I know your name, miss?
My name is Bina and I have this thyroid problem. I've checked myself with Dr. Hari but in another hospital. He also practices here, right?
Dr. Harido? Yes, miss. He has afternoon practice at 3 to 8 p.m. Did you meet him in Rumah Harapan?
Yes, last week. He checked on my thyroid problem and said that I would need an operation to take out the bump. I had wanted to have the operation in Rumah Harapan, but with or without insurance, the waiting list is pretty long. They have a lot of patients there.
I see.
Dr. Hari said if I would, he could have me operated here. But how much does it cost to have a thyroid operation in this hospital?
Well, it really depends on the kind of operation, miss. I can't say how much exactly, but it's around 30 million rupees. And that doesn't include the room, medicine, and doctor's visitation. But it may vary, depends on the severeness of the case and what kind of operation the doctor chooses to do.
Oh, okay. Could it be lower than 30 million?
It's possible but not by much. I'm sorry, I actually can't say exactly, but that's the average so far. We have to check on Dr. Hari again about your case.
And what about the room? What kind of room do you have?
Well, this is the list of the room in their facility. It ranges from 1,500,000 rupees per night, that's the VIP class, to 450,000 rupees per night. There's also the doctor's fee, depends on what room you choose for recovery.
How long do patients with thyroid problems stay in the hospital in total?
More or less a week, miss. Depends on the patient's reaction toward the treatment. We have to check on Dr. Hari again for your case. If you want, I can book an appointment with him, maybe this afternoon?
All right then.
Is it okay? This afternoon at 3 p.m. I mean, if the thyroid problem really bothers you, then you might want to treat it as soon as possible.
That's what Dr. Hari said. Now it's rather hard for me to breathe when I lie down. And it's also difficult for me to swallow.
All right, then. I'll put your name to the list for Dr. Hari's appointment this afternoon.
Thank you, nurse. I'll come back later, then.
You're welcome, Mississippi.